Hello, everyone. Today's April 27th, and this is our briefing. And we've had to switch times and go early this morning. And the reason we did that because the president and the vice president have scheduled a call for right after 1 o'clock. I think it's shortly after 1. I think it may be 2, but nevertheless, being able to do everything that we're going to want to cover in the briefing and then get to that call, so we had to move it. We had to move it up. No matter how many times I do this part, this part is the most difficult, and we've lost 4 more people in West Virginia. The 33rd, 4th, 5th, and 6th deaths have occurred. We lost a 67-year-old male in Kanawha County, an 88-year-old female in Jackson County, a 92-year-old female in Jackson County, and a 76-year-old female in Jackson County. Again, no matter how many times, that I say this, and you may get dull to the number of times, but I'm just going to keep saying it. Every one of these people have a name. And every one of these people have loved ones in their families. I'm sure this was a dad and moms. And so please keep them in your thoughts and prayers. And as we go forward with this terrible disease and pandemic, it's difficult, to say the very least. And it's really hurtful, when we lose loved ones and we lose great West Virginians. And so I would just say to you, like I said, keep them in your thoughts and prayers, and know that we're dealing with something here that nobody's ever seen. The balancing act of what we're trying to do is unbelievable, and it's that way all across the globe. I've got a couple more announcements before I get into the nitty-gritty of today, but the Paycheck Protection Program, the second round of that for small businesses started today. I would encourage anybody that wanted to apply, that maybe didn't get their applications in time, and then all the monies ran out, be sure that you get back in line and apply, because these dollars will flow to you in the small business community, and they will absolutely be flowing back into West Virginia, and that's good stuff, because every dollar we can get back into West Virginia will help us to be able to jumpstart our economy and do the goodness that we do for our people every day. I want to report from Workforce, we had 1,100 claims filed for the self-employment claims, that went into, well, we had in excess of 10,000, that happened as of Friday night and over the weekend, on the number of claims that were filed, and that's good. I hope that you're finding ways, or finding that the ease of getting through the wickets and everything in regard to filing your claims and us processing your claims, that maybe that backlog is way behind us now. I was just looking at my notes to see if there's anything else here. Of the applicants that have filed, the second largest category of claims filed have been our restaurants, with 18,000. Our hospitals and elective medical procedures reopening this week will put back to work a little over 11,000 West Virginians. That's good. And as we start to reopen, more and more and more will go back to work. We'll monitor it with everything in us and everything to make sure that you're safe, and that we can get back to work and get back to work in a safe fashion. Now, let me leave my notes just a minute, and let me talk to you about this. Okay, here's the balancing act. You know, I have tried with all my soul, with the experts all around me, to protect you in every way that I could possibly protect you and keep our numbers as low as I can possibly keep them. Everyone should completely realize that West Virginia sits not in the mountains where we're protected in every way. West Virginia sits right in the middle of a population center that is 2/3 of the population of this whole country. And we have border counties all the way around us, states all the way around us, and access to us all the way around us. And we have the oldest community and the community that has the most chronic illnesses, diabetes, whatever, obesity, whatever it may be. So we are the breeding ground. We are the spot where everything could blow. Okay. So in all of that, if we were situated right in the area where we could be exposed to the biggest degree, we had to do something phenomenally right in order to be able to keep our numbers where we kept our numbers. Now, there's no question the experts did really good. There's no question maybe that I had the right instincts as far as to move us in the right manner as best I possibly could. But at the end of the day, you as West Virginians really, really, really listened to me. And you did it. You did it. You absolutely amazed the world. You're sitting right in an area that absolutely we could have had devastation here like you can't imagine. Absolutely, without any question. And you did it. You, as the great West Virginians have done so many, many, many times, you did it. You listened. You kept us apart. You absolutely have done something that is unbelievable in a situation that nobody's ever seen before. Now we got to make more decisions. And now it becomes even more difficult. And I want you to understand this from my perspective. My perspective is just this. I'm not going to listen to anyone that is exerting pressure on us to do something that our experts and I myself think is wrong and that will endanger you. I am not going to do that. And I am not going to listen to those that don't want to do anything, that want to sit on the porch and never do anything because at the end of the day, that will kill us too. It's tough stuff. Now, and how do you figure a way, a system, where you can understand? Where you can understand that I'm not just saying, well, my experts today said this, or there was this political group that pushed us to do this, or whatever it may be. Something that we can all, as West Virginians, be in together. Something that we can look at every day, all of us, as West Virginians, and move ourselves forward. Now, think about this. Over and over and over, you've heard Dr. Clay Marsh or Dr. Kathy Slimp or myself or Secretary Bill Crouch and everything. You have heard us over and over say we're continuing to trend around 4%. You heard 4%, 4%, 4%. You also heard that the nation is trending at 20%. And the surrounding states are all trending from 8 to 15%. And it's true. It's true. And then we have constantly watched that number, 4%, 4%, 4%. And then all of a sudden, we started expanding testing in the most vulnerable areas of all, the nursing homes, where we could have had the worst results, to where the numbers would have gotten worse. And as we expanded the testing and everything, we're starting to see a trend line to where the numbers are getting better and better and better. Now, So it gives us the metrics to where you can watch it, I can watch it, and absolutely all the health officials can watch it, and we can stay right on top of it together. You see, at the end of the day, West Virginians, listen to me. West Virginians, the way we will win this battle is all of us running across the finish line together. When we start to divide and we have a faction that says, go back, and another faction says, don't go back, and all of a sudden, before you know it, we're pulling at each other in every way, and we can't really understand because there is no metrics on what to do, then really and truly, we become bewildered and we become distrustful, and when we become that, we will become divided. It's the wrong thing to do. So, I really believe this. The good Lord, I really believe, comes up with the good ideas. And I hope and pray this is just that in every way. Because I came up with this idea, and I'm not good enough to come up with ideas like this. I came up with this idea that what we would do is just simply this. You know, a lot of times when you dumb it down and you make it to where I can understand it, all of us can understand it, and it's not so complicated that you know, we're not going out here trying to count the cows dividing by, counting the legs and dividing by 4. We're just going to count the cows. And so if we just say just this, let's just do this, let's just watch that one metric all the time. And what it is a percentage of the number of tests taken to the number of positive results that we have. Now, that metric in the last days has dropped from 4.2 or whatever to 3.75 to 3.42 to 3.06. And today, right now, for the first time forever, we have dropped to a level below 3%. So, as we go forward, what I want you to do, West Virginia, and what I want to do myself with our health people is just say this. We're going to start reopening things. And we're going to start reopening things if we get 3 days consecutively under 3%. And I truly believe when we get to final numbers as of today, we'll be on our first day today under 3%. Now, we have had all kinds of work in consultation with the legislature, especially the leadership, especially the leadership from the standpoint of the majority party and everything, in our president of our Senate, our Speaker of our House, and lots of work that we've done together. Now, in that work that we've done together, we have incorporated their ideas, my ideas, our medical experts' ideas, and the good Lord's idea that really just maybe the way to follow this is a metric that all West Virginians have the ability to understand. And that is just this. If we drop below the 3% level, and we stay below that 3% level, we're going to begin our comeback in West Virginia. And I'm going to unveil that to you right now. I'm going to it's going to start up on the screen, and you'll see that's going to be our logo right now. West Virginia Strong, that's exactly what you are. West Virginia Strong, the comeback. That's exactly where we want to go. So, as I'm thankful to the legislative leadership, and I'm thankful to our medical professionals and our experts beyond belief, as I'm thankful to the good Lord above first and foremost, and my family and all the great stuff that my people are doing in every way, now I present to you the next leg forward, done with the science of a metric behind it, done with the science of how we have watched every day the percent of positives to the percent of tests taken. A metric that we can truly all watch every day and measure. So West Virginia Strong, the comeback, I am announcing that to you right now. Okay, Jordan, if we go to the first slide, it says the comeback roadmap. We have to have expanded testing capacity. We have to have, we have to have the ability on an increased hospital surge capacity while allowing elective medical procedures to restart this week. We are ramping up our supply of PPE, and we are ramping up our contact tracing capabilities. West Virginia should continue, and this is very, very important. If we want to keep this rate, this percentage number under 3%, here's where you, West Virginians, have to help one another and have to police yourself and have to help in every way as we move forward to try to get you back to work and try to get you back to a lifestyle that is not restricting. You must continue to practice physical distancing. You must wear face mask protection when you don't have the ability to social distance. And so protect yourself and protect others when you come in closer contact with one another. Follow the statewide stay-at-home order until it is completely lifted. Follow all county health department regulations and telework where possible. Work at home where possible. Now, the opening criteria. 3 consecutive days. 3 consecutive days just watching the numbers. Maintaining a statewide cumulative percent of positive test results below 3%. Remember, we were trending at 4. We were happy to be trending at 4. The next closest state to us is Kentucky, and I think they're about 8.5. But we were trending at 4, and we were happy at that. But now we have real results that say we are trending under 3%. So what we want to do is maintain that, West Virginia, and to do that, you have to do the things that I just outlined. We're allowing people to open, but we're not requiring them to open. That's really important also. If you feel uneasy that you can't protect your workers, or you can't social distance, or you can't do the things that you need to do, we're not requiring you to open. We're not doing that at all. This is where you'll watch every day. This is the percentages that I get. And right at this moment, and this will change throughout the day, but right at this moment, we've dipped down to 2.47%. That'll change. That'll probably drift back up into the 2.8 or 2.75 today, but we feel very confidently that right now we have the first day that we're under 3%. Now, if you'll just watch and look at this chart, and this chart is from March the 30th to April 26th, and that's through yesterday. And as we bounce and bounce and bounce each day, we've spiked up and down and all over the place, and you'll see that we have moved and moved and moved, and now this chart as of yesterday was at 2.7%. Okay, now what we're going to do. In week 1, that's right now, our hospitals and elective medical procedures are going to begin to go back. This is going to bring back almost 11,000 people that we mentioned earlier. Outpatient health care, working with boards and associations to develop appropriate criteria. We're doing that. We're working towards what we're going to do as far as bringing back primary care, dentistry, physical therapy, occupational therapy, psychological and mental health. And we're also working to try to get our daycare staffs back to work, and we will test all of our daycare staffs as we go back to work there. Now, one thing I want to say about daycare, and it's true about all the stuff that we're trying to do here. We are taking baby steps way before we walk. We are going to be very, very cautious in our steps, and we're going to monitor and we're going to watch these numbers in every way. There was a lady that brought up this and said, well, how am I going to go back to work? You know, I had 125 kids, and now I'm going to only have 25 kids. I can't support the staff. How am I going to go back to work? Well, we have all kinds of issues just as that. And absolutely, if you're not able to economically go back to work, or you don't have staff to be able to staff your businesses, then that's the decision of yours. That's why we're saying we're not mandating you go back to work at all. We want to try to help you to be able to economically to sustain your work and absolutely do it in as safe manner as we possibly can. But we need our daycare community back as we start to develop and move in the right direction to be able to go back. In week 2, a week from tomorrow, or a week from today, if we continue to trend the way we're continuing with those numbers that I'm talking about that you, West Virginians, will make happen or not make happen, our small businesses with less than 10 employees can go back. Our professional services, such as hair and nail salons, barbershops, dog grooming, and that kind of stuff, they can go back in this manner. Here's what it'll be. It'll be just this, because to be perfectly honest, a lot of people probably want to get their hair cut. We have to find a safe way to be able to have people get their hair cut or ladies get their nails done and everything else, and here's what we can do. If we have the proper PPE that we can supply to our salons or to our barbershops or whatever, what we want to have happen is this. We want you to be able to call, make an appointment, stay in your car until you're called in. As you go in, we want to take your temperature. We expect you to wear a mask. Then we'll take care of your hair and nails or whatever it may be. The people that are working there absolutely will all wear masks and gloves. And if they can do that, we'll open that back up. Our outdoor dining and restaurants will be open at that time. Our churches and funerals will be open to limited gatherings that have never been closed. But what we will encourage is just this. If you were to go back to church and gather at a church, we would like it to be every other pew with social or physical distancing. And in addition to that, we would hope that you would abide and wear some form of protective face mask, especially, and believe it or not, something where we can be exposed more than anything is singing. And there's always rejoicing and singing at church, and so we have to be careful. So wear some kind of face mask there and everything, if you would, please. Please observe all the physical distancing and the sanitation and all the face coverings. In weeks 3 through 6, that's when we're going to start back with office and government buildings, specialty retail stores, our parks, our restrooms, gyms, fitness centers, recreation centers, dine-in restaurants, which will have all kinds of stuff like at a maximum of 50% and a maximum of 4 at a table and all kinds of things that we'll be rolling out on that. This is only the 80,000-foot flyby, and there's going to be a lot more rollout right behind all this. But at this time, our hotels, casinos, spas, and remaining small businesses will be able to go back. And each week, we will announce what is going to happen the next week, a week in advance. So we'll be announcing guidelines and everything a week in advance. This is really important, and I hate it, but it's the right thing to do. There's no timeline right now for reopening our visitation at our nursing homes. You know, that's the big one that I hate, because I wish to goodness we could do that, but everyone knows that's where this problem with the incredible amount of deaths that I have had to come to you about, or across this nation, you know, the incredible amount of percentage of deaths by the number of deaths you have are happening with our most vulnerable people at our nursing homes. So we've got to have no timeline as of yet as when we're going to be able to lift and be able to have visitation at our nursing homes. Also, in addition to that, I see no reason in the world for us to all crowd into movies or sporting events or concerts, and any gathering of in excess of 25 people at the end of week 3 through 6 will still be prohibited. Now, it says right here, the conditions for reopening slow or for reopening to slow down or stop or reverse. Now understand, and please understand just this, our experts and all the numbers people are going to be watching all across West Virginia in every way. If there's an unexpected increase in COVID-19 positive hospitalizations, we slow, or we stop, or we back up. If there's a significant outbreak of community-based transmission, you know, in an area, you know, in any area, then we slow, we stop, or we back up. Now, that does not necessarily mean that if we have an issue at a nursing home and it's limited to that nursing home and it's not community spread, we may look at it a different way. But if we've got a hot spot that is a community spread situation, we're going to have strike teams that are going to be there instantaneously, and then we're going to evaluate from the standpoint of the numbers. And it may very well be that we have an area in the state of West Virginia where we've got to back up significantly, and other areas that are working and moving forward. The cumulative percentage of positive test results will guide us along the way, but we will still have evaluations county by county and hotspot by hotspot, and absolutely we will not neglect a hotspot because the cumulative average is such. We have got to watch every single one of these hotspots and move forward in a way that's prudent there. I guess I'm almost to the end here, and it says, West Virginians should continue to practice physical distancing. Please do that. Wear face coverings in public where other social distancing measures are difficult to maintain. Follow the statewide stay-at-home order until lifted. Follow all county health department regulations, and please work at home and telework when possible. Going forward, the guidance for each business sector will be released in advance, and we will do that at least a week in advance for everybody. Limitation on size of gatherings still is in place until lifted. The testing data tracked and analyzed every day will be working with you every day, every single day on that. Your reopening plans will be modified as necessary, and you will get the following updates nonstop on coronavirus.wv.gov or governor.wv.gov. Now, you know, I don't often read to you. My dad often said that son, if you can't get it done in 24 hours a night, you got to work nights. Well, I'll promise you there's been a lot of people that have worked a lot of nights. And we've come up with a methodology that we think will move us forward with science and math behind it, and experts behind it, and leadership behind it, and absolutely moving in the right way that will give you, West Virginians, the right to just show off again about how good you really are. As we bridge from where you have already accomplished the unbelievable to bridge towards going back, show them, West Virginians, show them just how good you are. Help one another. Reach out to each other. Absolutely protect one another in every way. We don't want to get anybody else sick. And believe me, B, I don't want to sit here and read to you that we've lost another West Virginian. Please, West Virginians, show off again. Bridge us to the West Virginia strong, the comeback. And that is you, West Virginians, just showing off just how great you really are. I think it's a great plan. We're going to monitor, we're going to watch, and we're going to take small steps. And as we take small steps, we'll see where we are. And if we got to stop or slow or back up, that's what we'll do. But I can't thank everybody that's been involved. I can't thank them enough. You've done good work, and now we're going to have to move forward. If we sit still, we'll die. We cannot forever sit still. Too many bad things happen. We've got to move forward. You've already done the greatest of all. I am so proud of you, West Virginia. You absolutely just make me beam every minute. You're the best of the best of the best. So on my birthday, I tell you now, show them again, West Virginia. Show them just how great you really are. Proud of you.
All right, thank you, Governor, and happy birthday. We'll next go to Dr. Clay Marsh, our coronavirus czar.
Yes, happy birthday, Governor. It's a very exciting day for all of West Virginia. And I'm going to make my comments brief, but I do want to address a few issues. So number one is that we know as a state, and as we read the recommendations coming from the White House Coronavirus Task Force and other countries and other experts, that there are gating strategies, there are requirements, so there should be, for starting down the path of reopening. And the four areas that the White House Coronavirus Task Force recommend are to see a sustained reduction in the number of cases over 2 weeks. And to me, as a guidepost, as we look at the rate of decline of the positive tests, as we continue having done many more tests, is part of that meeting of those goals. The other thing is we have also been following some other metrics, and this may be a little bit more complicated for the average person in the state or even in the country. But we've also followed the R0 value, which is the reproduction rate. And for those of you guys who remember, as we've talked about, that the coronavirus, if a person's infected, on average, they infect 2.5 people. And in the midst of the China epidemic, it was 5.7 people. Well, our R0 value, which has been coming down around 1, is now below 1. And so that implies that a single person won't even be able to infect another single person. And that's a very important sort of metric for us to follow, as well as the governor has talked about, as far as our being ready to enter this phase. And the other one is we're starting to see now an intersection between the number of active cases and the number of recovered or people that have been deceased. So we're starting to see that line overlap as well, which tells us that at a rate of growth that we are now catching up with a part of the population who has been infected and who is recovering. So I fully endorse the governor's decision to move back to to reopening. Certainly, as we know, this is a pandemic. The virus is still around. We believe, as the governor said, that West Virginia has done a tremendous job. You have done a tremendous job of doing all the right things to slow the rate of the virus growth. We talked about before avoiding the surge and flattening the curve. Well, you have flattened the curve, but flattening the curve really just means that we have bought ourselves more time to prepare, more time to get more PPE, more time to augment our testing, our surveillance. So that's really important, that we not forget that as we start to re-enter and open up West Virginia and the economy, which is really important, that we still need to protect ourselves. And by protecting yourself, if you're vulnerable, stay inside and work from home if you can. If you go out, as the governor said, stay the appropriate physical distance. We know that face masks, if up to 60% of people all wear them, then they're effective. And remember, the face mask is not just to keep you from getting the virus from somebody else. It's really to keep people that are not diagnosed or that are not symptomatic from spreading the virus by them laughing or talking or singing or coughing or sneezing. So it's really important that, as much as we can, when we're in closer confines with each other, that we go ahead and wear the face covering and face mask to protect each other, and that certainly will help. So the gating strategy of the readiness based on the spread, I feel comfortable we're ready. When it comes to augmented testing, we have seen a very large increase in testing from, increasing the capabilities of our own state's testing groups and labs, as well as in partnership. So we feel good about that, and we want to continue to expand our testing in the congregate settings, as well as in higher risk areas of our state and with higher risk populations. When it comes to surveillance, that's a challenge for all states, but we have a great team, and we want to focus the surveillance capabilities on the areas that are the most active areas in the state, and we're starting to look at that. And then having surge capacity in the hospitals and the ICUs and number of ventilators, the appropriate PPE, we have made a lot of strides on that, and the hospitals have acted very responsibly. So I feel that we're in good shape to initiate this plan. And as the governor said, we're in the phase that Thomas Puyo called the hammer and the dance. The hammer is we've suppressed the spread, we've knocked down the surge, we've flattened the curve. And now the dance is that as we open things, we will be watching very carefully for not only the whole state's sort of status, but also each county's, and we'll make recommendations to the governor, and certainly Commissioner Slimp and the county health officials are doing a fantastic job of doing the surveillance with the support of the Guard. So we feel that we're in really great shape, and we're the envy of the country, as the governor said, and it's critical that we work together and all take our personal responsibility. And if we do that well, I think that we will be the model for the country. So thank you.
All right, thank you, Dr. Marsh. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8 and Fox 11. A couple of quick things about testing. Are we basing the cumulative positive testing numbers on the number of tests given or the number of people who have been given the tests? Because now that we've rolled through nursing homes again, there are some nursing home patients, I'm sure, that have been tested more than once. Also on testing, African Americans are showing about 2.5% more positives than their population would indicate they would have. So I need to get the testing results for African Americans. How many have actually been tested in West Virginia? And then a quick question about workforce. Many self-employed and independent contractors were surprised to see a balloon pop up as they were trying to apply starting on Friday and over the weekend, that their claim had not gone through, need to be investigated, and could be at least a couple more weeks before that happens. Could you guys explain the process to them, to those people that may have been surprised or disappointed at that development and maybe not understand the vetting that has to take place? Thank you.
General, I think you got to jump in and start there, if you could, please.
Yeah, Kenny, workforce staff continues to work to address the various issues that you've described, and those will be addressed over the next couple of days moving forward. And we'll provide more information from workforce staff related to those issues that you outlined that some folks have with the process that's used moving forward. I can tell you that, as the governor pointed out, over 11,000 folks applied into the system. We did find that over the weekend, we did have enough staffing in place. The queues were available to manage the call volume that came in, and we'll continue to provide information back to you to address those challenges that were presented.
And let me jump in and just say this. You know, all of us know, I'm sure Kenny, you know, all of us know that as we move forward with a pandemic, and if we move forward with trying to protect our people and take these baby steps rather than big steps and everything, and as we continue to do so, there's always exceptions and corrections and things that we'll be doing nonstop with all the adjustments that have to be made.
Okay, thanks, Kenny. Next, we'll go to David Beard with the Dominion Post.
Hi, David Beard. While we're awaiting treatment drugs and a vaccine as we roll out this restarting plan, and let me back up a second. My question has two parts. But so while we're awaiting treatment drugs and a vaccine, are we looking at gloves and masks and social distancing for months, maybe even into next year? And part two is where are we in terms of having a widely available antibody testing? Thanks.
Well, I'm going to let our health community, answer the second part of the question. But David, let me make a stab at the first, because I continue to stay in constant contact with the White House and all the experts there that I can source as well. I mean, in doing this, that's the good part about, from the standpoint of, at least that I think from my standpoint, is the net is wide on the number of experts that we can draw from. Now, if I were to tell you what I think, here's what I think is going to happen from the standpoint of what we're going to do in the months to come. We're going to continue to have to social distance. We're going to have to, or physical distance. We're going to have to try every way we can to watch our elderly and to try to protect them and look out after them in every way. We're going to have to try to do all the things that the medical community is telling us to lessen our exposure, whether they be wearing masks in situations where we can't social distance and we can't stay away. But we absolutely are going to be moving in a direction that in the next few months, we're just trying to buy us more time to get to a drug that diminishes, and I can't say it any better than the head cardiologist at Johns Hopkins that I draw knowledge from there. He said we need a drug that will diminish this from life-threatening to a common or a bad cold. And when if we can have that drug that can do that, then we can surely move more forward, and that drug will only bridge us then, and that is the drug that bridges us to some level of safety, significant safety. But then that drug will bridge us to a vaccine, and that's what's going to happen. Now, as far as the additional testing and whatever like that, let the medical community answer that, because I don't have a clue about that. Clay, you've got to jump in on the antibody stuff.
Do you want me to?
Or Kathy or somebody.
Sure, I'd be happy to. Antibody testing is going to be really important. There's currently really not super reliable antibody testing capacity widely commercially available, but is well underway in development. And there is actually development of that in state as well as commercially out of state. And so that will be a really critical piece that comes down the road and will be really important over the summer, I believe, to really understand how, who's already had this disease and who's potentially protected from it moving forward.
Dr. Slimp's been out, you know, with Secretary Crouch doing all kinds of other stuff and everything. And Kathy, I'm glad to see you again and everything. I haven't seen you in a day or so and everything. But Dr. Slimp, thank you.
All right, thank you, David. I just want to make a quick announcement. The slide deck that the governor showed with the reopening plan is now live on our website at governor.wv.gov. Next, we'll go to Amanda Barron with WSAZ.
Hi, Amanda Barron with WSAZ. I want to go back to the cumulative test. When we're talking about, are we talking about the cumulative average of the number of people tested or the number of tests for that average? And then also I wanted to piggyback on the question Kenny asked about numbers for the African American community.
Okay, I'm sorry we didn't get a good answer on the African American community, but you know, Dr. Slimp or Secretary Crouch, do you have anything, or Clay, do you have anything to add to that? And then we'll go to the next.
I'd be happy to cover that one. This is a really important issue, working with the African American community to assure that there's adequate testing and services available. So we've actually put together a plan, and we want to be working with the community to do a variety of things. The big strategies are, of course, communications to make sure people have accurate information, having a task force, an advisory committee that we can work with throughout this initiative and integrate them into our management systems, and then also expanding testing within the African community to make sure that there's access to that, and then also working to assure that if an individual needs to be self-isolating or quarantining or otherwise managing the disease, that they've got the support systems available to make sure that's practical. So we look forward to working closely with those populations, very, very importantly. The differences around the country with African American populations are really uncovering existing health disparities that occur every day, and these are really important to address, regardless of it being COVID-19 alone.
Okay, and Amanda, maybe you could repeat your first question, please.
I can do the testing piece as well.
Dr. Slimp, go ahead. Go ahead, Dr. Slimp.
Sure. The percent positive is actually the number of positives over the number of tests received. So there are some duplicates, not many. That's predominantly a single. So it's the number of tests received. It is influenced by a couple of things recently, certainly. That includes the nursing home testing that we've been doing, and also the great work under the governor's leadership about getting all of our laboratories to report electronically. So that happened over the last week, and that all 37 that had not been electronically reporting now electronically report to us, which is great. And this is a fantastic move forward. So that also is affecting that percent positive. What's going to be important is that we follow that over time, that is it staying steady or dropping further.
All right, thanks, Amanda. Next, we'll go to Steve Adams with Ogden Newspapers.
Yes, Stephen Adams of Ogden Newspapers here. Hearing anecdotally about some people that were on unemployment before the pandemic, and I understand that through the unemployment insurance relief for COVID, that they can actually have their benefits extended up to 13 weeks under the Pandemic Emergency Employment Compensation Program. But I'm hearing people that have tried to get that extension and have been told that they can't receive that. I didn't know if that's something that is being heard of in the governor's office or in workforce, or if somebody could talk about that issue. Thank you.
Stephen, let me address, because with every question, you know, I keep going back to there's a name behind that question, and it is really meaningful to that person. Now, we've not had, you know, that's not come to my attention a whole lot, but I'll have Scott Atkins check on that and report right back directly to you on that, Stephen, because I don't have a whole lot of detail about it and everything. There hadn't been a lot of that that's come to my attention, but I'll have Scott get back to you.
All right, thanks, Stephen. Next, we'll go to Annie Moore with WVVA.
Happy birthday, Governor. My question is there any plan to loosen the testing requirements? Right now, you know, you've got all these different criteria, like you have to have a fever or you have to have come into contact with someone with the virus. Is there any plan to loosen that moving forward?
Annie, I appreciate you. I think that's going to have to go to Dr. Slimp and you know, and Dr. Marsh and Secretary Krause, if y'all could come in, please.
Sure. I'll start, and then let's Dr. Marsh, others speak in as well. Testing is such a critical part moving forward. We really want to make sure that we can make sure that diagnostic testing is widely available for anyone with potential symptoms of COVID-19. So any provider who is suspicious at all of an individual having COVID-19 can order that testing, and that's what we really hope and want to have available across the system. We also want to do surveillance testing in a variety of settings, high-risk populations, geographic distributions in communities, to really expand what we call a sentinel network to understand and track what's happening. So those are the plans that we have in place and would like to make sure are operational. There's been a ton of work to move towards having the testing capacity to do that. So there are increasing numbers of commercial laboratories available that we're tapping into and working with. There continue to be some reagent issues and supply issues. We continue to advocate for those components. We are working on additional tests that could be available in state. So I think this will be a growing area, but one that is critical here and around the country to make sure that we can really have the adequate test supplies and resources to operationalize those plans to absolutely track what's happening in every community.
And Annie, if I can just add briefly. So I think every country that's really been successful at the mitigation strategies have really broadened testing a lot. So as Dr. Slimp said, we have really worked hard to expand our testing capability. And we are going to target that to begin with to people that have the highest risk of dying from COVID and looking at the areas of our state that have the highest incidence. But yes, we hope to be able to augment and loosen some of the criteria as we have the ability to do that.
All right, thanks, Annie. Next, we'll go to Mark Curtis with WOWK.
Good afternoon. Happy birthday, Governor. Good evening, or greetings, everyone. Let me ask about the businesses reopening, the procedures here. Is this going to be on the honor system, or will the health department have to come in and sign off on daycares opening, restaurants opening, hair and salon places opening, or is it entirely up to the owner's discretion?
Okay, Mark, I just wanted to double check, you know, with our people here and everything. But most things, Mark, are going to have to be on a semi-honor system because we don't have enough people to go out and become martial law where we're running in and checking and counting the number of people and doing all that kind of stuff. We can't do that. But here's the thing I tell you, and that's why we absolutely needed, I think we needed some ability to bring in mathematics and science into the formula base of what we're doing. This is nothing but a metric, and really and true, at the end of the day, we may have to change this 10 other times, you know, as we go forward. But this gives us the ability to watch, you know, we're going to continue to watch every hot spot, watch everything that's going on. Hopefully people will whistle blow and they'll call us and they'll say, they're not doing this right here and there and everything. And then we can send people there and we can check out this and check out that and try to diminish hot spots and manage this disease. Everybody should understand this disease is not going anywhere. I mean, this disease is something that we've got to figure a way to live with. If we don't watch out, I mean, there's surely a bad outcome on the other side that if we don't ever figure out any way to live with it and we just stay stay at home and we don't do anything, there's really bad repercussions that could come on that side as well. So we got to figure a way to live with this until we get a drug that really gives us the ability to live with it, and then until we get a vaccine. Now, Mark, here's the deal. Every West Virginian has really got to step up here. And that's why I say over and over, watch those percentages. Absolutely, every West Virginian help to protect yourself and protect your family and protect others as well. And help us, West Virginia, help us continue to keep pitching a great number. And as we continue to pitch a great number, every day that goes by, we'll have more and more and more opportunity in West Virginia. So that's what we've got to do, Mark. You know, we can't go in and meticulously manage every situation. We have to be on an honor system to some degree, you know, but we can still expect the public to inform us and react to it, and that's what we'll do.
All right, thanks, Mark. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi, yeah, this is Taylor at the Herald-Dispatch. I'm kind of following up on that question from Mark. If you are going to call somebody, if you see like a place, a business not running properly, should you call the county health department or should you call the state? And then I'm also wondering, as we start to head back to work, if there are people who are maybe immunocompromised or live with their grandma and they're afraid to go back to work, will they be still allowed to get unemployment even if their business that they work at is back at work?
Okay, Taylor, the first answer is yes. You know, call your county health officials. If you don't get the satisfaction you get there or need there, call the state. We're fielding tons and tons of calls all the time. I mean, that's what we want you to do. At the same time, you know, going back to the other thing, we are not telling people they have to go back to work. All we're doing is saying you can go back to work, and you know, if you have all the concerns or whatever like that, then that'll be coming out in additional information that we'll have coming out later on today.
All right, thanks, Taylor. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Governor, have you had any additional discussions regarding the potential use of stimulus funds for backfilling budget shortfalls? And I say that in light of the tweet President Trump posted earlier this morning, basically saying, why should taxpayers be responsible for state and local government debt?
Phil, I don't have anything back on that right at the moment, but here's what I'd like to say is debt is a different situation. You know, pensions being, you know, just you know, with a terrible backlog of debt. We're not talking about that here. We're not talking about that at all. All we're trying to backfill here is the losses from this coronavirus. We're not talking about, and I probably agree with the president from the standpoint of, you know, there's some states that have these incredible debts, like Illinois wants $40 billion or some number like that. You know, I don't think that'll happen. I hope it won't, you know, from the standpoint of our federal government, but I do really believe that we're going to have some level of relief that in West Virginia, because we've run West Virginia in the right way, and West Virginia doesn't have this backlog of incredible debt and everything that we're trying to address, I think we'll be okay here.
All right, thanks, Phil. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Secretary Crouch, could you give us an update on nursing home testing? Are we almost done with that? And then anybody that could jump in with specifics of how we begin, how we're going to begin to do the daycare testing. Thank you.
Happy to do that. Thank you for the question. We're close to 80% complete with regard to the nursing home testing. Our folks and the folks at the facility level have done a terrific job at getting those in. We have about 64% of those results back, so we're waiting. As you know, based upon our on the dashboard, we're up to 43,000 tests at this point. We hope to be done, and we think we will be done within the next few days. Certainly by Friday, I think we'll have the remaining 20-some facilities scheduled, and I think most of those actually are already scheduled, so we'll have the data for those. All of the data should be in, the results should be in by the end of next week. Kathy mentioned earlier that we have completed tying in all electronic reporting for all of our labs that work with us, so we're getting those quicker. There is still an issue related to getting that information to the facilities. We need to make sure that the facilities have at least 24 hours to talk to the patient and contact the family before anything is published with regard to those numbers. But we look very good with regard to the nursing home efforts. Was there a second part of your question? Sorry.
Yeah, I was just wondering a little bit about the plan, more specifics about the plan to test all of the daycare employees, when we were going to start that. I mean, we're going to have to call in folks that are at their home, have them come to where they work. How is that actually going to work out?
Yes, right. Good point. That we got the information together this weekend for those numbers in terms of those workers. We're going to start that immediately, and we'll get those individuals tested as quickly as we can. We're also looking at another list in terms of kind of phase 2 in testing and where we go with that. So we'll keep you notified of that as we move forward.
All right, thanks, Charles. We have time for one more question. Let's go to Paul with WCBC Radio.
Thank you. Good morning, Governor, and happy birthday. Question about the federal prisons, and a number of questions. I'll throw them out there, and then you can field them as you see fit. When did you find out? How did you find out? Did you get any response to your letter? And do you have any options if they don't give you the answer you want?
Okay, the first thing is, I have sent a letter, I've sent a letter to the president, to the federal government and everything in regard to my objection to bringing the prisoners here, and I am very, very hopeful, and I know I'm joined with Senator Manchin and Senator Capito, and I'm very hopeful that we'll know more about it, by Friday, I think, by last Friday. I'm sorry, I got that backwards. We'll know more. We first knew about it last Friday, and as we move forward and everything, of course, I sent the letter immediately and all that.
All right, Governor, I'll turn it back to you.
Well, let me go back to just this. You now have a number to watch. The number we want to trend always is less than 3%. Please watch the number, West Virginians, and please continue to really try to help us. The lower the percentage on that number, the better, but we got to try to keep the number less than 3. And the other thing I want to tell you is just this, again, as I brag on you all the time, because I know how great you really are, and I've said it over and over and over. Your family, you're faith-based, and you're good people, you're craftsmen. You're the best. I mean, that's just all there is to it. And you'll always be that with me. But I've asked you so much to really bear down on your social distancing, bear down on wearing the mask, bear down on really trying to help us with the elderly, and going to get groceries for people and everything. Keep doing all that. Keep doing every bit of that, West Virginia, because that will keep our numbers low. Now, but I've got to ask you one more thing. And, I feel like I'm always asking of you. But, West Virginia, I've got to ask you to just do this. We've got to really be counted in this census. I mean, that is really, really, really important. And can you do this for just me? Can you call your neighbors, call your loved ones, and just ask them if they've been counted? Because that really will bring all kinds of extra dollars to this state that will enable us for years and years to come to help everybody. So I'd ask you again, West Virginians, as I've called upon you to really knock it out of the park as far as protecting our people, and you did it. And now I'm calling on you to knock it out of the park again as we're going back to work in West Virginia strong, the comeback. But I'm also calling on you now to really help me with the census, because West Virginians were not counted adequately before. And I need you, West Virginians, to step up and call and make sure we're all counted, because it'll really help us. We're winning this thing, and we got to keep going. We got to keep going and keep winning. West Virginia, I could never be more proud. Keep winning. Let's go right now. Proud of you. Thank you.